Hello and good morning, and welcome to the session today, WASH and Menstrual Health for Girls' Education and Sustainable Development. Welcome those here in Stockholm, but also welcome those who are online joining us. Now, before we begin the session, I think there is a way to ground us in what this is all about. We're going to be talking about a lot of data today. But at the end of the day, behind all the data is always people. So we want to start with this video from South Africa.
Nurturing good boys, raising better men.
Thank you. Yeah, I think we have to contextualize this as well as we do talk about menstrual hygiene and management. It is really in the focus of this presentation and so forth, really the supporting girls' education. So this session, as we understand, girls' education is foundation for gender equality, and it is critical to a thriving, peaceful, sustainable world. Water, sanitation, and hygiene, in addition to other elements related to menstrual health, are absolutely necessary for a girl's quality, as we just see, non-discriminatory education, and it's also linked to improved educational outcomes. Thus, we can always say this, then, menstrual health and WASH promote education, it promotes equity, it promotes development and well-being for both girls and their families. It is helping then achieve multiple SDGs, 4, 5, and 6. So today, this session will look at the current state of WASH in schools, but with a special focus on menstrual health. We will be looking at data. We will be looking at numbers. We'll be looking at it from various perspectives. We will start with the presentation of the Joint Monitoring Programme that will be done by Rick Johnston with WHO JMP. Then we will be followed by a presentation, a panel, and there will be 4 presentations. And unfortunately, the original plan was to have presentations, Slido, presentations, and then Slido. Unfortunately, the Slido setup does not work, so we will just take a few moments during that time to reflect, and Maria will be taking us through the panel discussions session. Then we will have another 2 other presentations by the Swiss Water Partners, Rahel, and then Splash with Megan will be following up. So with that then, we can begin perhaps with Rick Johnston's sort of helping us set the stage following the recent Joint Monitoring Program. So I'm just going to hand this over to you. You are free to use either this or this. You can use that.
Great. Thanks so much, Belinda. This is working? Yes?
Okay, you have to go. So it's just that we can just skip this one.
Okay. Yes. Okay. Good morning, good afternoon for those participating online, or good evening, wherever you are. It's great to see so many people here today at Stockholm World Water Week. I'm Rick Johnston from the World Health Organization, and I'm going to present highlights from the WHO UNICEF Joint Monitoring Programme's report on WASH in schools, which came out in June this year, and it has a special focus on menstrual health. There are also hard copies of the report in the room today. For those of you physically in Stockholm, please feel free to pick one up. So briefly, I'll talk about 3 things today. 3 things on my task list are to discuss basic water sanitation and hygiene, WASH services in schools, and also to look at not just the current status, but the trends, and to say something about how likely we are to reach the target of universal access to basic WASH by the year 2030. Spoiler alert, we're not going to meet those targets. But then the third section, I really want to focus in on this special focus that we had in this report on menstrual health services. So we are lucky that there is an SDG target under Goal 4 for education about WASH in schools. It's about having facilities that are child, disability, and gender sensitive and provide safe, nonviolent, inclusive, and effective learning environments for all. And those basic services include basic drinking water, single-sex basic sanitation facilities, and basic hand washing facilities. And they refer to the WASH definitions. So in our reports, we call them service ladders, where you can see several elements defining a basic service level. For drinking water, it's about having an improved source of water that's available on the school, at the time of the survey. The basic sanitation service is a little bit more complicated. It's about having sanitation facilities at the school that are single-sex, but are also usable. And by usable, we mean that they're actually available and functional and private, so that people can use them in privacy at the time of the survey. And finally, that hand-washing facilities should be available with both water and soap at the school, again, at the time of the survey. And then we also try to distinguish amongst schools that don't have those basic service levels between schools that meet some of those requirements, and we classify those as having limited services, versus those that really don't have any kind of level of service and are at the bottom of those ladders. So with those 3 definitions then, let's look at what we found in the report. Well, a first thing to note is that all of our data come from national data sources. So we collect and compile data coming from different types of national sources. And this is the 4th report on WASH in schools that the JMP has produced. And this figure shows that the number of data sources that we draw on has been steadily increasing from 495 in our first report to 1,415 today. So it's nearly tripled. So that's great. You can also see that we get data from different sources. The dark blue there, or the dark gray, are coming from education management information systems, or censuses. We also get quite a lot of data from UNESCO Institute of Statistics, which are reported from countries directly to UNESCO. And then quite a small number, actually, of facility surveys. If we would look at WASH in healthcare facilities, we would see a different picture where most of the data is coming from facility assessments and relatively few coming from routine MIS-type systems. Okay, so let's dive in then and look at the basic water service. We found that we had data from, let me see, check my notes here, I think it was 138 countries that represent 65% of the global population. And we can see that globally, there was an increase between 2015 and 2022 from 66% coverage to 77% coverage. So that's about 1.3 percentage points per year, but it does mean that there are still 447 million school-aged children who lack basic water services at their schools. Now that's down from 620 million in 2015, so there is progress, but there's a way to go. If you look at the regions, these are the SDG regions, there's one that really stands out as having a big slope up, and that's Central Asia and Southern Asia, where there's one very large country, India, which has shown tremendous progress that's really driving that steep increase there from just 50% to, I think it's 84%. Okay. Good. And if we look at the other SDG regions, though, we see that things are relatively more flat and even stagnant in some cases. Now, that small chart you see on the right, that shows the rates of progress from individual countries and whether those rates of progress would be sufficient to reach universal access by 2030. And we can see that of the 53 countries that do have trend data, only 19 of them are on track to meet that target of universal access. So that's a bit of a bummer. but we can highlight some countries that are doing really well. So you can see some of the named countries here up near the top of the diagram. You have India, Panama, Serbia, Syria, and Togo, which have all seen increases of more than 5 percentage points per year, which is really tremendous if you think about it. Increasing coverage by 5 percentage points per year at a national level is quite impressive. So most of those countries are on track to achieve universal coverage. But in the case of Panama, which is a high-income country, because the baseline was lower, it was only 19% of schools having basic drinking water facilities in 2015, that even with that high rate of progress, they're still not quite on track to 100% coverage by 2030. Next, let's look at sanitation, where we have a similar level of data coverage. We have estimates from 144 countries that represent 68% of the global school-age population. And also the coverage levels are similar. We see at the global scale coverage rising from 68% to 78% of schools having basic sanitation facilities in 2022. And that's a rate of progress of about 1.2 percentage points per year. So quite comparable to drinking water, we could say. If we look at the regions, we again see that Central Asia and Southern Asia are showing really rapid growth, but we also see other cases where Eastern and Southeastern Asia and even Sub-Saharan Africa are showing impressive growth in basic sanitation services in schools. Then looking at the triangle figure on the right, we can see again some rock star countries that have again achieved over 5 percentage points per year progress. We can see Croatia, Indonesia, the Philippines, and Syria again. And way up at the top there, you can see Senegal, which has achieved nearly 10 percentage points per year coverage, increasing basic sanitation in schools. So rapid progress is possible when governments make this a priority and dedicate resources to do it. We can also see that among those countries on track, almost half of the 51 countries with data are on track for universal coverage, 24 of the countries. And among them, you see Syria, and that's actually the only low-income country in the group. We use different shapes for the country markers so you can see the income level of the country based on World Bank classifications. Turning to hygiene, again, we have data from 134 countries. That's representing 63% of the school-age population, so about 2/3 of the global population covered for all of these basic service indicators. We see maybe a little bit slower progress from 58% to 67% in 2022. That's 1.1 percentage points per year. Here, actually, we see the strongest growth coming in Sub-Saharan Africa, which had quite a low baseline, but has really shown tremendous progress. We also see a lot of progress in Central and Southern Asia, Latin America and Caribbean, Northern Africa and Western Asia, and Eastern and Southeastern Asia. So a lot of regions are seeing growth in hygiene. Maybe that has something to do with the COVID and the emphasis on reopening schools in a way that's safe for children and for teachers. It's hard to say why. We do see, though, that in Oceania, the levels are both quite low and actually maybe even decreasing and certainly not showing any rapid progress. So this is an area that might require some further attention. And then looking at those triangle charts, we can see that Bangladesh, Cambodia, Niger, and Zambia all achieved increases of greater than 5 percentage points per year. Niger and Cambodia actually had similar rates of progress, about 6 percentage points per year. But because the baseline coverage was much lower in Niger, they're not on track to reach universal coverage by 2030, whereas Cambodia is. And if we look among low and middle income countries, we see Bangladesh really standing out as having nearly 8 percentage points per year. And actually, there was only one country in the world that had a higher rate of progress. That was Croatia, a high income country. So those are the country and regional averages. If we look at the rates of progress, then we can see that in none of the cases is the world on track to reach 100% coverage by 2030. And in fact, we would need to double rates of progress for basic drinking water and basic sanitation and quadruple rates of progress for hygiene, again, because the service levels are lower for hygiene. There are some regions that are on track. So we see that Australia and New Zealand, Europe and North America are already at universal coverage. But if we look at water, Central and Southern Asia are on track. Remember India showing that tremendous progress on basic drinking water in schools. And then for sanitation, Eastern and Southeastern Asia, also Northern Africa and Western Asia are on track to reach that goal. Unfortunately, none of the regions are on track for hygiene, I'm afraid. So all of these data are available on the JMP's website, washdata.com. On the left, you can see we have country files that will include both those estimates that I just shared and all the national sources of data that we draw upon to produce the estimates. And we have a new product on the right there. We call them snapshots. And these reproduce some of the graphs that you've just seen and some of the graphs that are included in the reports, but they're in an Excel format, so you can play with the data, you can change the data, and they're also available for different regions, SDG regions, income group regions, WHO and UNICEF regions, et cetera. So please do check out our website or scan the QR codes for those. Now, those basic service levels are really just that. They're quite basic. And we know that there are a lot of important aspects of WASH services that are not captured in them. So we try to highlight examples of higher levels of service or advanced levels of service where countries do have those. But we're not at a stage where those are standardized and harmonized so that we could say anything about regional or global trends. And we also do try to focus on a special focus area for each report. And this year, the focus was on menstrual health, which is a growing interest. And also, I'm happy to say, there's growing data available on that. So you'll see in the report, there's quite a long section, actually, that goes into different aspects of menstrual health. What kind of data are available? We had data from 7 out of the 8 SDG regions, from 30 countries that had at least one national indicator. And we really drew on this work coming from the Global MHH Monitoring Group that came out a couple of years ago. You can see the URL for it up there. But they identified different domains and recommended a set of 21 core indicators about girls' and adolescents' experiences around menstrual health. So some of the high-level findings that we could come to were that only about 2 out of 3 schools globally provide some kind of menstrual health education. We see this as a gap in high-income countries as well as low- and middle-income countries. And really, many schools don't have any provision for management of used menstrual materials in toilets, things like bins for sanitary disposal of used menstrual products. And again, that's a gap also in high-income countries as well as low- and middle-income countries. I just wanted to share briefly the list of 21 indicators from that MHH monitoring group. We're not going to read them all, but for each of them, we tried to see if there was any national data available that was either that indicator or pretty close to that indicator. And then this summary table lets you know how many countries had some kind of data that was comparable, and also which figure we used to highlight that in the report. So that's my last slide. I'm going to summarize and just say that a lot of countries, an increasing number of countries, do have national data on basic WASH in schools. We're not on track globally to meet the SDG targets. We need to increase the rate of progress by double for water and sanitation and by 4-fold for hygiene. But that there is a lot of progress on the data side for increasing coverage of information about these emerging menstrual health indicators. And I think we'll see a lot of development in that space going forward. So with that, thank you.
Thank you very much.
Pick up a copy of the report.
Thank you very much, Rick. And we're going to bring you back later on during the panel for some questions and exchanges. There might be also some stuff online, so we'll get you sort of hooked up with that. Thank you very, very much. And yes, there are copies right over here, so please take one as you go. Great. So, as things are, one looks at this and you say, oh, there should be all of these things I should do. And then I realize, oops, I forgot something. But anyway, I think as we're setting the stage, and thank you very much, Rick, for setting the stage on the data, I would like to invite now Ms. Rika Son to kind of give us also, to sort of set this stage from the perspective of BNZ. So please, you are welcome. And maybe you can come around this way, or you can just jump right up. Yeah. Yeah, and you can choose either the microphone here.
All right, this one. Here. Wonderful. Thank you so much. In fact, I feel there's nothing better than setting the stage, that some good data and some real-life input. I couldn't have done it any better, so no worries at all. And very happy to be here, actually, and setting the scene for all this with all those wonderful partners. And let me say also maybe menstruation enthusiasts, for all those who know, who have one, please show it to me. Yeah, there are some that know this great campaign. Thanks to UNICEF and thanks to all the partners here, the Wash in School network hosted by the GSZ, the Joint Monitoring Programme for Water, Sanitation and Hygiene of UNICEF and WHO, WaterAid, London School of Hygiene and Tropical Medicine, Splash, Swiss Water and Sanitation Consortium, Columbia and Emory University, Save the Children. You can see such a big amount of people working on this, and I'm really happy we are at this point now and that the time is ripe finally to break the taboo on menstrual hygiene. So May 28 this year, we celebrated the 10th anniversary of International Menstrual Hygiene Day. And it really highlighted that this is a really crucial aspect, a fundamental aspect of human dignity. And Germany, alongside Spain, we have championed this cause actually at the United Nations, particularly through resolutions on the human rights to water and sanitation. And access to washing services in school is not just about health. I think we heard about that. It's about education, it's about gender equality, sustainable development. It's about ensuring every child has the opportunity to a safe, supportive learning environment. So I think by improving access to washing in schools as the public institution taking care of the entire child and youth population, our measures can reach a huge proportion of the population of a country directly and indirectly. And ministries of education can play a big role, as we have seen in the video in the beginning. My ministry, the German Federal Ministry of Economic Cooperation and Development, we have recently published also a new publication on this, which is called Breaking the Menstrual Taboo Together. And it underscores our commitment on menstrual health and hygiene. Unfortunately, at the moment, it's only available in German. So for those of you who speak German, we're very happy to provide it. For those who don't, we are working on that translation. So hopefully next time we see each other, we can also provide you with the English version of it. And so you can also have access to impactful social media campaigns designed to break the stigma, like the campaign that we did, for example, with the Let's Talk Period, which we are funding. So, Let's Talk Period. And it has reached over 10 million people in countries such as Albania, Nepal, Zambia, South Africa, we saw the Philippines. And I'm proud to say that we remain committed to WASH in schools. And I would like to extend my gratitude yet again for all the wonderful organizers, all the wonderful panelists. I'm really excited to hear what you have to contribute and to say. And I wish you a very successful continuation of the session. BMZ is grateful for the trust and impactful partnerships that we're having here. And seeing this room full of people actually makes me even happier. So let's make universal WASH in school a reality for a dignified start in life for all children around the world. Thank you so much, and I wish you a fruitful session. Thank you.
Thank you very much, Rika. I'm so glad we got your words in because I do feel even more motivated than before. So thank you so much. So now I will be passing on my moderation role to Maria. But just before, I just want to say the objectives for this session. Now we're going to go into 4 presentations, but the objectives for this learning session were, number 1, to learn about the global situation, which Rick Johnson has already set for us, to gain awareness on resources which are also available to support improved monitoring, and to understand what some countries are already doing, and as well to be inspired to improve monitoring and programming in WASH schools and MHH. So with that, I pass it on to Maria Storrusten.
Hello everyone, I'm so excited to be here. My name is Maria Storrusten. I'm a program specialist on gender equality. I work with UNICEF at HQ, and I'm so thrilled to be moderating this panel discussion that we have planned for now. We have about 1 hour. It was great to see, the urgent need to really work harder to reach progress needed. And now it's really time to go into the details on what should we focus on to improve WASH and menstrual health and hygiene in schools. So we have 4 panelists here, and then you're really welcome to during the presentations to either online to kind of share your questions, reflections. We have Bettina Sophie who's moderating online, and then also otherwise we'll have some time midway through to reflect. Bettina Sophie will share the reflections, and at the end we'll have 15 minutes for your questions and reflections and an interaction discussion with all the panelists. So really keep in mind the questions you'll have along the presentations. So I'll start with presenting the first panelist, which is Professor Robert Dreibelbis from London School of Hygiene and Tropical Medicine, who will speak about a global review of WASH in schools. Welcome.
Okay. Hi. Good morning, everyone. These lights are incredibly bright on here, so I have no idea if there's anybody there. It could be an empty room, but we'll just go ahead and roll with it. I need the... here it is. Okay. Cool. So again, my name is Robert Dreibelbis. I'm with the London School of Hygiene and Tropical Medicine. I'm going to present a few highlights from a recent scoping review that we've done on WASH in schools, trying to understand the impacts and trying to understand kind of what we know about the evidence base for WASH in schools. For those of you who don't know, briefly, a scoping review is a form of a systematic review, where rather than looking at one specific study, we look across all of the studies we can find, and we try to kind of come up with generalized estimates, either of kind of how things operate or the impacts of those. Now, this is something that helps inform policy decisions. It helps us understand what interventions work, what interventions don't work, or what specific interventions, what type of impact we can have with those. So it is really an important tool for translating some of our kind of quantitative research findings into actual policy and practice. So the last comprehensive review of this was completed in 2019, so about 5 years ago. For our particular study, we managed to find 83 studies that met our inclusion criteria. These were interventional studies looking at WASH in schools and associating those with either health or educational or behavioral impacts. I'm going to focus today on the on the health or the educational impacts that we found across these studies. Important to note, this 2019 study that was published in 2019, it found they weren't able to kind of combine any estimates. There was too much heterogeneity, so too much diversity in how we're measuring impacts and how we're describing those for them to really pool anything together. So that was one of the reasons we tried to do this review, was to see could we find ways to kind of synthesize this evidence in a better way, or in a way. We were able to find 65 studies that haven't been in previous reviews, so quite a bit of new data that we're able to integrate here. And for the purposes of this, about 36 of those 83 studies were specific to behaviors, so we're going to put those to the side right now. Our final result that I'm going to talk about, 47 studies, which were looking at 54 distinct intervention comparisons. So that's kind of the data set we're working with here. So the first part of this is really, what are the outcome measures? So I have the unenviable task of trying to explain a lot of diversity to you of why we can't really pool any estimates here. So we look across all of our studies. These are divided basically, we defined specific domains of outcomes. So anything related to all-cause absence, absence due to a variety of illnesses, or specific health outcomes. And then the table kind of cuts off here a little bit, but there's other educational outcomes as well. Sorry for the formatting challenges here. Across the studies we found, we're looking at 144 distinct outcome measures in 249 different comparisons that are being made. That's a lot of data points for only 40-something studies. These measures consistently varied by definition and assessment methods. So 100 of these 144 different measures were unique to each study. That's really not great. As we're talking later about priority indicators, just really the importance of this, to understand something, we need to be able to measure it, and we need to be able to measure it consistently. Kind of as a slightly closer look with some of this stuff. So something as simple as absence, and now that makes sense. Absence can be defined in different ways. We found 7 studies that were measuring absence, and across those 7 studies, absence was measured and defined in 5 different ways. And as another example, for respiratory illness, we found 5 studies that were measuring the impact of wash in schools interventions on respiratory illness, but these were measured in 11 different ways. So now we're not even seeing multiple definitions between studies, we're seeing multiple definitions within studies. So we're measuring things in so many different ways within this, it really becomes impossible to kind of pool any type of estimates. This is my plea as both a researcher and someone who works on that kind of policy to research to policy and practice interface. Think about standard indicators and how we can use those. In general, we found kind of some studies were going very specific. This is a kind of scatter plot of the number of domains that a study was looking at and the number of outcomes per specific study. In general, you probably want this to be a straight line. So for this domain, we're having one kind of outcome that measures it. Unfortunately, it is not a straight line at all. What we found are some of these studies, these are just examples, so many outcomes across many different domains. So you can see on the far, what's this, left for you? You're right, sorry. Bowen et al. With various ways in which absence due to specific illness are measured. So it just becomes kind of quite difficult. So linking this all to gender, because I think this is the other important part, among these studies, 65% of them did not report or talk about gender disaggregated data. We're just presented with data for all students. If we're operating under the assumption, and I think it's probably pretty valid, that there are specific needs for girls, then we need to do better about this data. Only 4% of studies that we found had fully disaggregated data. Another 12% would disaggregate on specific outcomes, and 19% of them said they tested for differences among gender, but didn't actually provide the data for that. But in general, 65% of these studies, no disaggregation. They're just reporting for pupils and students. And I'm pointing the finger at myself. I'm an author on some of these studies that don't report on gender disaggregated data. So we need to do better. And then finally, kind of looking at this across those specific domains. So I mentioned earlier, we have educational outcomes. Those can be things like enrollment, kind of gender parity in enrollment. About half of those were actually were able to reported gender disaggregated data, but across all of our other areas, we see really limited gender disaggregated data reporting, most on absence all cause and then kind of infection status. That's a lot of kind of deworming or kind of NTD, helminth infection levels. So overall, just really limited reporting on gender specific or gender disaggregated outcomes here. So just to kind of wrap this up, and this QR code will take you to the protocol for this review. We're in the final stages. It should be in preprint within a couple of weeks. Understanding the impact of WINS is important for our sector. It helps identify effective intervention strategies, and it helps inform policy decisions and resource allocation. The evidence base for WINS, though, suffers from a lot of non-standardized indicators, and we're using too many different ways to measure and quantify the impacts of what we're doing. And it means we can't pull that together, and we can't really tell the story in the way that is often used to inform policy and practice. Further to that, there's even in all of this diversity, the one diversity we're not doing is capturing the diversity of impacts for boy students and girl students, or whatever words I'm supposed to use there. So with that, I thank you. I think there'll be questions a little bit later. So.
Thank you so much, Robert, for a very, very interesting and relevant presentation. I think it was, coming from a gender perspective, very eye-opening to see this huge amount of data not being gender disaggregated. So this is very timely then that I'll welcome the next panelist. Welcome Bethany Caruso, who is assistant professor at Emory University, who will share experiences from the Global Menstrual Hygiene Health Monitoring Group initiative to strengthen national monitoring of girls' menstrual health. Welcome.
Thank you. To move these mics down after Robert. There we go. Yeah, thank you. Yes, my name is Bethany Caruso, and I'm here speaking on behalf of the wonderful group I work with, the Global MHH Monitoring Group. Some of those colleagues are online, so for those of you online, and even those in the room who have questions, they'll be able to answer some questions as well. So for those who are not aware, I'm going to do a brief introduction of these priority indicators, which Robert has teed up the justification for quite well. But I also want to not go over each indicator, but talk about what our key learning has been since we've launched them, and talk about what our needs are now that we have them. Indicators are great, now they need to be used. So just to sort of further the argument that Robert already made as to why we need these indicators, we need to be mindful of what we're measuring, because what we're measuring spurs action and is what people pay attention to. Further to that, when we have data, it can spur stakeholder accountability for those actions. When there's a big gap, people know where to react and what to do about that gap. Or not, maybe they don't know what to do about it, but they know they should be doing something about it. Further, we have a lot of governments, a lot of stakeholders and agencies who are starting to put together guidelines, who are starting to put together policies and programs. And these indicators help us to see if they have any effect. So to like what Robert was saying, if we're all measuring these in different ways, we're not able to effectively and consistently assess progress over time. Further, we can get investment when we have data. And also, it's really important to see change over time. What we can do is assess and compare when we have comparable indicators and measures. We can compare across geographies, we can compare across populations, and even within countries, we can identify if there are certain domains that need work, certain populations that need work, or other regions of the country. Now, so what this document is basically a short list of indicators, priority indicators, for this set of comparable data. It's just 21. It's intended to be targeted towards adolescent girls and schools, but some of the adolescent measures could be adapted towards adults with some testing. And we've really tried to leverage existing documents and tools and even data related to JMP, MIX, or DHS. We don't want to recreate the wheel, but leverage the data that's already being collected at scale. And just for clarity, what it is not is a comprehensive list. We know that there are some gaps, but we didn't feel confident putting out measures for absolutely everything. We needed to be precise on this, and of course it can be expanded. It's also not technical guidance on data collection, and some of those measures need further validation. So for those who are not familiar with the document, there are 21, Rick also mentioned this, indicators across 7 domains. Many of them are at the individual and school level, though a few are also at national and policy level. So here's just going to zoom in on a few to give a snapshot, and specifically at indicator number 3 to give an example of what kind of information is in the document. So what we have in the document for each indicator, we share what the indicator is, we talk about what the purpose of that indicator is, we then present the survey questions that we recommend people adopt for measuring, which of course, as Robert also said, when we have different ways of measuring, different definitions, we can't compare. So we have a recommended way of measuring in a survey. And then we also provide evidence and considerations as to why we picked the indicator and why we picked the measure, a justification. Now, Rick did a great job, thank you, Rick, and the whole team for talking about these JMP indicators, the priority indicators and how they've incorporated them. And the only thing that I wanted to emphasize is how awesome this table is, because I think we can learn a lot just by looking about where we have data and where we don't. And so one key learning that we have already is that we actually have a lot of countries, for example, that have something on school level data. That's of course in part because we've leveraged for the priority indicators, something that the JMP was already doing was looking at sanitation in school. And so then that gets buy-in. Also, it's easier for countries to be measuring at the school level. What's harder? Individual level measures, especially among adolescents. Data collection at scale is less. So if you look at indicator 1, there's only 4 countries, for example, that have that. So this is a real need, are the individual level indicators. Really understanding girls' experiences specifically. So some quick information about the learning from since we launched this. We've been working with different countries, specifically Bangladesh, Kenya, and Philippines. We were working with them when we were creating the indicators and several other countries since. What we've learned is many of these countries have existing policies, strategies, guidelines, but that highlights the need for the adoption of indicators to see progress in these locations. There's also data for some, but this is periodic, and things like MIX, the MIX module for menstruation, is now optional, and it also costs money to add. So if countries want to adopt that, they can get some of this information, but it's an extra cost. Further, the other thing is that MIX, DHS, these big scale data collection efforts, they start at age 15. So we have a huge gap in our understanding of anybody younger than 15, and we really need to get information on very young adolescents. The school level indicators are easily adopted comparatively, particularly for government systems where there are already monitoring systems set up. So these are kind of the low-hanging fruit, but harder for where there isn't systems already. NGOs and INGOs have a role to play, and I think what's really exciting is we're going to hear from presentations next where there are data being collected, and while they might not be able to do this at a nationally representative level, this is so important to start getting evidence for our learning. The other thing is, it's hard to just uptake. There's capacity issues, there's resource issues, and there's a need for further investment. So some key learnings around this. This integration, this uptake will take time, it takes effort, it takes ownership. It's not going to happen overnight now that we just have a document of indicators. But it's essential in order to have this happen to bring together diverse stakeholders. People who work on MH, especially among adolescent girls, are people in ministries of education, ministries of gender, ministries of WASH. It's a broad set of stakeholders, and getting them all together to get consensus is a challenge. We've also learned that different countries can help each other learn based on what their process has been. They don't all have to start at zero, and so working with all these countries, we've been trying to share learning across these spaces. But there's also a need for clarity on roles and responsibilities because of the different stakeholders and agencies that might be involved. So what is needed now? Data. We need a lot more data, specifically among very young adolescents at the individual level. And we need advocacy for these indicators to help get countries on board for collecting this data so we can start reporting consistent and comparable data over time and across spaces and populations. And what we're doing as a collective group now is continuing to the best that we can to support country uptake. And we're also trying to track, much like that table was doing, of who's using the data, where's the indicators, and where is data coming from. And ever since I walked in this room just like over an hour ago, I've already had people come up to me and share, and that is very, very exciting. And we need to, we're also advocating for investment to support countries because it is costly, it is time consuming. And of course, we need to make sure that it's possible. And so to sort of end on what you can do and potentially think about, my pitch to you, from the donor side, there's always donors that have indicators that they ask people to track on as well, so doing that, but also not only integrating, but funding uptake testing and use. National governments, many governments might actually be collecting some relevant data already. So the first step is actually to review and see what you're collecting and see if there's any alignment, and also review the indicators to consider if there's one or two that might be appropriate for adding. NGOs, INGOs, those of you who are already collecting, and so many of you are, like keep doing it and get in touch. This is a good step in further supports and helps support governments to see the value of it, which is incredibly useful. And anyone, be in touch if you're using it. We'd love to hear from you, even if you have challenges, because this is a draft 0, and we can keep learning and keep going. So with that, thank you all so much, and I will turn it back to you.
Thank you. Thank you so much, Bethany, for a very clear and really, really important presentation. Really exciting to see the progress made, but also the kind of challenges that lays ahead and what still needs to be done. So thank you so much. Before we then go delve more into experiences using the indicators, we wanted to just, because we know there's been some interactions online, so I wanted to let...
Bettina Sophie is saying there isn't so far. It's quiet. They're listening on, so we can continue,
great.
I think, and then we'll have a nice discussion at the end.
Sounds great. Let's continue then. I'll welcome Rahel Künzel, Knowledge Manager from Swiss Water and Sanitation Consortium, who will share experiences using and adapting some of the global priority indicators for girls' menstrual health. Welcome.
Okay, welcome also from my side. I'm working with the Swiss Water and Sanitation Consortium. It's based in Switzerland. We're a consortium of 8 Swiss NGOs supported by the Swiss Agency for Development and Cooperation since 2011. We focus on our work on WASH in institutions, so healthcare facilities and schools. In our current phase, we have 16 projects in 12 countries. And we just started to collect data for a baseline study. So this was a good time for us to also include these MHH priority indicators that were just introduced to you now. For the schools, we have projects in 9 countries covering around 300 schools. In this presentation, I will look more into 5 countries, namely Burkina Faso, Cambodia, Ethiopia, Niger, and South Sudan, where we already have a pre-analysis of 130 schools. Here is a list of indicators that we looked at in our baseline. So we're looking at the availability of menstrual material in case of emergencies, at basic level sanitation facilities, at private rooms with water and soap available for menstrual management, at MHH education, and at the indicator whether a teacher is assigned to this topic. The project from SWSC also asked about discrete disposal mechanisms and MHH budget at school level. But now let's have a look at the first pre-analysis of data. What we can see that except Niger, the basic level of sanitation is reached in about half of the schools that we observed. And in the front row, you can see in brackets how many schools were surveyed in each country. But so there is some basic sanitation facilities, but other infrastructure is really scarce and is not available in many of the countries, like private spaces and discrete disposal mechanisms. It's worth to mention that actually there are 47% of the schools in Ethiopia have a private space, but the challenge is that there was no soap at the time of the survey. This might be connected to the fact that there is no dedicated MHH budget in many of the schools. What we saw is that also if there is MHH budget at the school, mostly it's provided by parents, and only in 25% of the cases it's actually the municipality or the government who is providing it. The good news is that there is some menstrual material for emergencies in Ethiopia, and it can also be found in some schools in Burkina Faso and South Sudan. What is really striking in this table, or at least it was for me, is that in Ethiopia, more than 90% of the schools, they have a teacher who is assigned to MHH. It's especially astonishing because in other countries, that's not the case at all. When we now look at the 4-column to your right, you can see data on MHH education in schools. What we can see is that more than 50% of schools in Burkina Faso, Cambodia, and Niger, not Niger, unfortunately, South Sudan, they have some kind of menstrual education, either for boys and girls or for girls only. And in Ethiopia, it's more than 90% of the schools who report that they do some MHH education. But what you can also see from this data is that often MHH education is only starting for teenagers, and almost no school is reporting MHH education for students from 9 years old. So now what are we going to do with this data? As mentioned before, it shows us where the gaps are, what advocacy is still needed in which country. And we also saw that advocating for to start MHH education early at age 9 is a priority in all of the countries. We'll also continue to push for improvement in access to infrastructure and material. And now you've seen all this data that we collected, and you might ask yourself, what about the individual questions? I'm proud to say that the Swiss Water and Sanitation Consortium has been working with we have aligned with the research of Northwestern University and UNC to develop the institutional wash insecurity experience scale in WISE. It's like the other WISE scales that already exist. It looks at not only at availability, but also at how wash services are conceived by users and what their experience is with it. So currently, we are testing these skills in healthcare facilities and schools, and for students, for patients, and for staff. And some of the indicators are also on MHH, especially for the students. There we have 11 in-WISE candidate items, and they also align to the indicators that were presented earlier, as you can see on this slide here. So we are focusing on the questions on menstrual material, on menstrual management, and also on class participation or missing a class because of menstruation. So as there's also validation necessary for the priority indicators, by testing the INWISE questions will also support this validation of the MHH priority list indicators. So tests have started, and AWAC was the first one to test it in Uganda. And we can see an example here of how what was the outcome of this test and how the girls who were answering the questions, what their reaction was and whether the questions were understood and how they have to be realigned later. Further tests are planned by various contributors in Ghana, Nepal, Rwanda, the Philippines, and Ethiopia. The aim is to conduct these tests in at least 12 countries so that we have a list of cross-contextually relevant questions that can be used everywhere. If you're interested to test the INWISE scales as well, and you're working in in a project where you anyway do data collection, then it would be great if you can get in touch. You can contribute, and if you can contribute, so you can get in touch. You could get in touch with Josh or Christina, whose email is on this slide, or also talk to a colleague who is here, called Michelle. So thank you very much for your attention. Over to you.
Thank you so much. Really exciting to see this work and more details on the testing and experiences using the indicators. Now it's time for the final panelist. Welcome Megan Williams, Director of Behavior Change with Splash, to share more about the results from an in-depth evaluation of Splash programs to improve mental health in schools. Welcome.
I feel like I was very well queued up because we're talking about Ethiopia and the priority indicators, so this is perfect. Splash is a nonprofit that's focused on securing wash-in schools for kids in urban areas. We've built a model based on the principle that the fastest way to reach a high concentration of kids is by working in public schools across entire cities. Within our wash-in schools package, we include low-maintenance filtration solutions, girl-friendly sanitation solutions, drinking and hand washing stations, and then behavior change programming that involves hygiene as well as operation and maintenance, and of course, menstrual health, the star of the show. In culmination, this is Project WISE, Wash-in Schools for Everyone. And we have just completed, or we are about to complete, phase 1 of that project, which was across 3 cities in 2 countries, India and Ethiopia, reaching about 900 schools and over 800,000 kids. We're embarking on a feasibility study now to expand that into phase 2 of this project for 2 additional countries and 4 to 5 additional cities. But what I want to start with today and focus on is our menstrual health program. So the vision that we have for this is to create a sustainable program that transforms the physical and the social environment to really improve the lived experience of girls during menstruation, but also beyond throughout their puberty. To achieve a shift in social norm, we have focused on a variety of different programs. One is our core program for the girls, which we partnered with WASH United to be able to leverage their curriculum and educate girls through both the classroom setting as well as within gender clubs. And then we created some additional materials for really addressing the social ecosystem surrounding a girl. A peer mentoring program where we can create safe spaces for girls to be able to have conversations with each other. A program that is focused on educating boys, not only about menstruation, which is a key part of it, but also their own changing bodies. And then finally, a parent workshop, because we found a lot of girls were getting information from their parents, but sometimes that was misinformation. And so building up their knowledge as well as their confidence to engage in that conversation. And then we also have a key part of this project which is focused on the infrastructure. We know the school environment is a very important piece if they are going to be comfortable to manage their menstruation at school. And so through government-funded collaboration, school toilets have been outfitted with durable hardware to meet those global standards. Having stalls with doors that lock, having good ventilation and lighting, hooks and shelves for girls to use their products, and of course waste bins that were mentioned. To assess this program, we conducted a mixed methods longitudinal study, and we had multiple data points where we collected this information at baseline, 9 months after implementation, and then 1 year after implementation. Our sample size was 200 girls, 100 boys, 100 mothers, and we did that from 10 randomly selected schools. Our real aim was to assess these programs that we had just delivered to 100% of schools in Ethiopia. We wanted to really understand, was the impact having the effect that we expected? Were boys increasing their allyship and support of their female peers? Were parents having an increase in their knowledge and their confidence to be able to engage in that conversation? And then of course girls, were they having an increase in their own knowledge and their self-efficacy to be able to manage their own menstruation? And what I'm very excited to say is that while we collected a ton of data and a lot that wasn't represented in the priority indicators, we did collect about 75% of those, and in fact 100% of the individual ones, which you highlighted as a huge gap. And so this was a really exciting opportunity for us to dive in when we were thinking about, even this presentation. How can we have connections between organizations and really build that common language to be using the same data? This is going to be a very quick snapshot of that data because it is extremely limited time here, but I would be happy to dive into it later. This is also hot off the press. We just got this data last week. To dive into just a few of these, I'll show a bunch, but to highlight a few of them, one of the ones that we called out was the percent of girls who reported changing their menstrual materials during school. A lot of times when we've done some of the formative research, we find that girls will go off-site, go to a household or a friend's house to change their materials because they don't feel comfortable within the school setting. And at baseline, that was 64%, and then at endline, it was 87%. Interestingly, there was still a lower percentage of girls that were reporting that the space was clean, private, and safe. I'm guessing that leans on the cleanliness part, but they are using the facilities. Within the knowledge category, one thing that's interesting in comparison to what Rahel was sharing, we found at our baseline that secondary students were reporting lower rates of receiving menstrual health programming compared to primary, which is a question I'm curious about to dig into that. But then at the end line, we saw both of those increase. Likewise, we conducted a knowledge test with girls and found at baseline only 57% of students had the correct knowledge of the fertile cycle during their ovulation. And then at endline, that jumped up to 71%. So we were seeing improvements in the girls' knowledge. For discomfort, for both the girls' report of their ability to manage their own menstrual pain, as well as their comfort to seek out help from healthcare providers, both of those had pretty significant increases. And then there was also an increase just in girls' general report of being comfortable to find support for managing their menstruation. The final one I'll highlight is within the health impacts, the percentage of girls who reported that their menstrual period did not impact their day. At baseline, it was 60%, and then at endline, it was 95%, which is quite high. So I'm really curious, and I'm sure after this, we'll go to do a bit more of a qualitative exploration to understand how did that really change that much. I mean, there's so much within this these insights that really allow for further questions to come up. And as I mentioned, we collected information from boys, from mothers, and that's not represented here. But I think this is a really good starting point to be able to understand the impacts of this program. As far as further insights, I mean, we really see this as a launch pad for looking at how can we continue to improve this program. And then, like I said, how can we work with other organizations to see, are we looking at the same thing? Can we learn from each other about how these programs can have a deeper impact on the girls that we want to try and have impact on? The other thing that we're starting to see is some relationships between the indicators, and I think that's something that we're going to continue to do analysis on, and I think has a lot of potential and opportunity for further insights within the mental health research. That's it for me for now, but if you have more questions, I'd be happy to stay and answer afterwards, and then we also have a booth on the 4th floor, so you can come by and I can chat your ear off about this. Thank you.
Thank you so much, Megan. Such an exciting presentation. Congratulations on the work and you've done. And especially I was impressed by, or encouraged by seeing the last indicator on such a big improvement in terms of girls not being impacted, which is kind of really the end goal, I think. So congratulations again. And now it's time for the panel discussion. So we'll have, I think you can stay here, because I'd also like to invite the other panelists and Rick as well on the stage. And then luckily, I think we're quite good on time. As I said, we have about 15 minutes for, where we welcome everyone to ask their questions and reflections to all the panelists, and we can go more into discussions on this theme. And we'll have Linda, I think, who will help with the microphone. So.
Yeah, I'll help as well. I've got some other CWE volunteer help too, so it's great.
Excellent. So, but before starting, I'll just, since we started up with Rick, laying really the foundations with the data on the challenges and situation for mental health and hygiene, I wanted to just share, if you could start with sharing just a few reflections based on the other presentations among the panelists. And then we'll go over to, so have your questions ready as well, and we'll afterwards open up for questions.
Well, my general reaction is excitement to see that data are being collected, and that will open all kinds of doors about exploring what indicators work and don't, but also what we learn about the services that are being delivered and received in schools. I think that's super exciting. A broader impression that I had, though, is that when we talk about menstrual health and hygiene, we also have been talking for a long time about breaking taboos. And it seems like taboos maybe are reduced. I don't know. I mean, 10 years of Menstrual Hygiene Day, that's great. I'd be really interested to hear from people in the audience, people online, and the panelists, if how you find reactions when you bring up the subject of menstrual health and hygiene, whether it's with adolescent boys and girls, teachers, administrators, parents. How's the progress on the taboo front? Those are just some quick reactions.
Excellent. Thank you so much, Rick. So we'll open up, for a first question.
Hi, Rick. Thorsten from Wash United. On the question of taboos and stigma, I think we can say a lot about that by monitoring MHD for the last 10 years. And of course, we see that there is more conversations every year. There is more social media contributions. There is more media coverage of the issue. I think in the first year, all of us celebrated MHD. There was 89 pieces of media coverage. This year, it was 23,400. So it's ridiculous how it increases. But what I see also from the data that you presented, when we see that only 2 countries report on the supportive environment, we see that the whole issue of taboos and stigma of underlying negative social norms is not yet really reflected in the indicators that we have. And I just urge us as a community to take that on. And it's something that a lot of WASH sector actors are not really comfortable measuring, what is in people's heads and attitudes and social norms. But if we really want to create a peer-friendly world, it's something that we need to track. And yes, looking at social media contributions and media coverage is great, but to have more qualitative data that really tells us how dialogues in societies, in countries, how social norms evolve over time is something that I think like we should really tackle in moving forward.
Thank you so much for sharing this really great reflection. So another question?
So basically, I like to talk about the ground situation. Maybe in the last 10 years, can you hear me? Yeah, so maybe in the last 10 years in the urban population, there is a change. But when you talk about ground, because I'm from India and we are working in Madhya Pradesh, and we are working in the WAS theme only, but we started with hygiene, toilet hygiene, hand wash. But when we want to talk about menstruation, there is still a lot of hesitation. The teacher themselves says that no, let's wait. Take some time. We don't want to talk about it. So there is a huge gap, that is for sure, and a lot needs to be worked on. Thank you.
Thank you so much. A lot has been done, but there's still much more to do.
Hi everyone, this is Raju Tirua, working as a gender equality and social inclusion specialist for Sustainable Wash for All SUSWA project. I am from Nepal. So I have few questions regarding this MS. We also work for this menstrual hygiene management. So my question is that actually the session was related to the menstrual health and wash for girls, especially for school girls. So while talking about the menstruation, actually we have to also consider those who are named as gender and sexual minorities, such as LGBTQIA+. So what are the issues you find so far? Because this trans man also gets the menstruation because he has some problems in this regard. This is one question. And another one is what kind of MS friendly, I mean the user friendly, considering the menstruation structures of WAS to be constructed, considering not only the boys and girls, also those groups, LGBTQI groups, plus persons with disability. I mean the girls with disability, boys with disability, or other. And the next one is that your research, research also the sample I found boys and girls, so we didn't found those groups considered as during the data collection. And next one is actually in your presentation I found that there are some taboo social norms that are impacting not going to school during menstruation. So could you please share some sort of those norms which are obstructing going to the schools? Thank you.
Thank you for this. So we'll let some panel wants to respond to the reflections and questions.
I mean, these are really fantastic questions. I think we have a lot of internal conversation regularly about the trans community and how do we engage that topic. The way that we've seen it is we have to also explore where the communities that we're working with are, what is their communal practice and beliefs, and find a balance of pushing, challenging, and also respecting the cultural norms. And so even to try and push the boundaries on bringing dignified spaces for girls and giving them an uplifted voice is something that is at baseline not there. And so we find it a delicate balance, and we're always constantly having moments of checking within ourselves internally and with our teams that are the local teams of how far can we push further. So I think it's a long conversation to be able to reach progress and have equity for all, truly all, but it will take time.
Thank you for this response. Did you want to come in, Bethany?
Add one thing. I think this is really, really important. And from a measurement point of view, there are questions that can be added about how people identify in various ways, and that could be about their gender identity. It could be also about disability status. It could be about ethnicity. Those questions can be added. What's important to know about collecting that data is if collecting it and even asking about it could potentially put the person at risk. And that's one of the challenges with collecting some of the data and then reporting on it, even in the US. I mean, people feel like if they reveal that they have LGBTQ, if they, whatever their sexual orientation is, in some cases, that could be very, very risky. So that's just one thing. It doesn't mean that we stop learning and stop understanding from a programmatic point of view and doing what we can, but that's just that on that side. For another set of priority indicators for gender and WASH that we'll be talking about a little tomorrow, we do have some guidance on trying to find the most context-appropriate other data that could be added to support further understanding for these intersectional identities that are really, really important, and I think that's a great point. I think the only other thing that I was going to say, sorry, Thurston, this is like a sun in my eyes, and I know you're out there, but I can't see you. I can't even look in that direction. Stigma is important. Social norms are incredibly important. We wrestled with this, creating the priority indicators, because to measure these latent constructs actually requires a lot more work and a lot more measures for an indicator. For the task we had, we identified priorities for the moment that we felt confident putting out there that people could do. So your challenge to us, I'm looking over there, but I can't. Your challenge to us is a good one, which is we should be developing those, and we need to. We need support to do that, and I think that would be a really good next step, and I think everybody's on board for doing that. We just didn't do it at the moment, and we talk about that in a paper as to why we didn't for now. But this is a growing process, not an end.
Yeah. And please remind us to present yourself when you start. Thank you.
Okay, so my name is Juhi and I work in India, and I was fascinated by the work you've done on the indicators. I just want to talk to 2-3 points which we have been addressing. Social norms are not very easy to challenge, question, or even monitor at times, even in countries where I come from. My colleague from India has already given an example. I also wanted to understand that when we talk about MHH programming, how are we looking at the entire process of empowerment and adolescent development and support of WASH institutions which exist in the communities? Because institutional strengthening is something which we feel is the enabler for MHM, and whether we place it in WASH or nutrition or in any other program, that is something which we need to look, because it causes a lot of violence on women, girls, and of course intersectionalities, as he has said. The second thing is then when we work with a lot of trans men, we work with a lot of persons with disabilities, we even work with female sanitary workers. And I point them out because the entire value chain of waste collection, of menstrual waste, so the entire value chain approach somewhere, needs to be prioritized, especially when we are talking of climate resilient MHM and WASH. So these are some of my observations, in no way a comment on what you are doing. We are absolutely delighted to be working with WASH United and to incorporate all the indicators. But these are some of the reflections as we go forward. If we can look at these, it will help all of us to sort of move forward maybe in a better direction. Thank you.
Thank you.
Okay. Sorry, I'm going to say. Hi, I'm Isabel. I'm a student of Global Health, and I just conducted research this summer in Cambodia about menstrual health and hygiene education, and it was qualitative research. So my question to you now, obviously I also came across those indicators, and I had difficulties connecting them to my qualitative research, because obviously they're not numbers, but it's still important to understand what's behind the numbers. So I was just thinking, or wondering if you thought about how it's best to connect the qualitative data on menstrual health and hygiene together using those indicators, or another idea of like connecting them. Yeah.
And we'll just take, I think, is there one more question before we hand back to the panelists?
Thank you. Hello, my name is Svenja. I'm from a German toilet organization, and we just published last year a study on school sanitation in Berlin, actually. A very rare example together with Uni Bonn. And we included menstrual hygiene management, of course, and it was also recognized in the report, and we are very happy about that. So what we don't really see is like a discussion on advanced services in high-income countries and also how the relevant institutions actually use them and publish. So I was wondering if, how this is also included in, for example, Imori or others. Thanks.
Yeah.
Hello. Thanks. I'm Linga Miho from Malawi, and thank you for the presentation. I wanted to just indicate that one of my observations is that there's very good data and information that has come through, but I think we really need to build a movement around addressing the structural issues in terms of budget provision for MHM. I see that quite a lot of this work that is happening around menstrual hygiene management is being driven by projects, by NGOs, by local communities, NGOs supported by donors. I've not seen the major shifts that need to happen in terms of governments being able to really make the provisions and also be consistent in implementing what they put in the policies. So I really think we need to build a movement around this. A footnote on that is the need for us to also make sure that there is very good interconnectedness between the gender, education, and health sectors. Because I really think that the gender movement has been able to move a lot in terms of making this a priority, but I still think that there's not much activism happening in the education sector to make the necessary dents. Because to a large extent, if you look at my situation in Malawi, whilst the gender sector can prioritize this as an issue, addressing gender inequality, social norms, but the budgets provision for the MHM lies with the Ministry of Education. And I really think that there needs to be a way in which we can engage the Ministry of Education, we can engage the Ministry of Health and Water and Sanitation so that the conversations are really pointing towards making a real dent. Other than that, there's progress, but I think there's huge progress that can be made by building a whole movement that's across the sectors. Thank you.
Thank you. So I think we just have also one question from online.
Yeah, there's one question for you, Megan. They're asking if Splash is engaging with national and local governments for uptake of the indicators in their systems.
So I think there's really great questions and reflections. Some are linked to kind of the approach and institutional approach on menstrual health, linked to other sectors, gender, WASH, education. Others are also linked to kind of measurement indicators, difficult to measure, social behavior change norms. So I'll let the panelists kind of, welcome to step in, and maybe Megan, do you want to go first? And then open for the others to respond as well. Thank you.
Thank you. Yeah, that's a really great question. And I mean, we just received this data on the priority indicators, so no, we have not then taken the step of integration. But I will say that kind of to your point and to cover both of around government engagement, we did have a partnership with the government to deliver this program, and we developed new standards on sanitation facilities that are now a part of the government standards, and they were actually the ones to pay for the sanitation facilities. They paid upwards of about $8 to $11 million. And then also with the indicators, we have been working with sub-city level who are doing the monitoring of schools and trying to work with them on integrating some of various wash-in schools into it, because there's actually no wash tracking for the schools, so they're not monitoring anything. So we are engaging that, but it is a very long conversation to be able to have that shift.
Thank you. Anyone who wants to come in Yeah, Bethany and
Sure, I'm trying to remember them all. I should have written some of them down. Maybe the work that you noted on Bonn. I think that's really interesting. That with the University of Bonn was your partner. Is that right? Yeah, I think having more from high-income countries is really useful. We're trying to understand more in the United States as well. We have 50 states. Potential for 50 different policies. I'm working with a colleague to just even review what's out there. Some have mandates but no funding. Some have funding but no mandates. Some require from age 10 to and they're all different and they're all across the board. And we're trying to see okay, can we use the indicators and how applicable are they then if we wanted to work with school systems in the US, like in Georgia where Emory is. And so that's something that really is going to be important to think about because high-income countries are not off the hook here at all. It's so important. Though they think they might be thinking they are. For the qualitative question, I think one of the things to note is that the group of people that came together to start working on this actually has a deep and long history of doing qualitative research. And actually, one of the reasons came together to do it in part was because finding, much aligned with what Robert was saying, that there actually wasn't as much quantitative data. Qualitative data is cheaper to fund. So research was funding a lot of us to do qualitative data because it was small, but doing things at scale. And then those of us who did things at scale, the measures were not comparable. And so that was one of the, so it's really, all of it's really informed by a rich base of qualitative research and systematic reviews for that. So in terms of comparing it with your own data, I think it'll depend on what kind of data you collected to see, and if it was aligned with some of those questions. But it's okay if it's not. I mean, getting other insights on MH and girls' experiences in schools is still an additional, an important force in and of itself because it reflects directly what girls are talking about. The indicators, again, are priorities. They're not exhaustive at all. Other stuff is important. Qualitative is a really important complement to, and neither should be a substitute for the other.
Thank you so much. I think we just have a couple of minutes. I just wanted, in case if someone wanted to share a few final reflections, open. Yes, Rick, come in.
If I can just echo Bethany's comment about high-income countries, absolutely not off the hook. I think for menstrual health and hygiene indicators, these are still developing and new, and we haven't said this is the basic set or basic service level, so it's too early to say what an advanced level would be for those. But just want to shout out that things like for hygiene, a lot of schools in high-income countries don't have soap at facilities. And hand washing compliance, oh my gosh. Though girls are better than boys, we know that. And for sanitation, we know experiential student experiences show in some high-income countries, like France, that even though they might have 100% basic sanitation, the students find those toilets filthy and they don't want to use them. So I think the work that Rahel and others are doing on the experiential scales will be highly relevant in high-income as well as all countries, really.
So I think thank you so much, Rick, and thank you so much to the whole panel for really great presentations and reflections. Thank you so much for the audience for all the reflections, questions as well. I'll now hand over to Matt Friedman from Emory University for some final reflections and wrapping up.
Well, thanks to the panel and thanks to all of you. I was just asked to be a discussant and just have 1 minute at the end here to wrap up. And I really enjoyed this session because I think so I'm from Emory University. I'm a professor of environmental health. My name is Matt Freeman. And I do a lot of implementation science work. So oftentimes academics, we might overcomplicate or complicate things, but I like to really think about when we're trying to think about evidence to kind of practice and impact, we start to think about should an intervention work, should an improvement work, can it work in the best case scenario? Does it work in the real world? And then how do we adopt and scale those improvements using interventions? And then along the lines, how do we measure it? And how much does it cost? And I think what we saw in this panel in this set of discussions is really touching on all those steps. And so should it work? We think it should. And I think that no one would argue that improving menstrual health in schools will improve educational outcomes and mental well-being and sense of belonging. But on that point, we often, and what I like to see is that we've moved from trying to justify menstrual health to other outcomes to saying menstrual health itself is inherently an outcome that is valued. So that's a huge step for those of us that have been in this sector a long time. We're no longer trying to justify it for other kind of infectious disease or absenteeism, but saying it is itself valued. The question of can it work and does it work, I think we're not quite there yet, and Robert kind of touched on that a little bit with his talk, but we do see models, and Megan and Splash's model, showing that yes, it can work, and there are systems in place and there are programs that can make it work. How do we measure it? Bethany and Rick touched on how do we measure it, and we're making progress in that realm. But the thing that, and I want to amplify, I think it was Belinda from Malawi, I'm not sure I got your name right, what she said about governments and understanding how to scale, adapt, and create policies that engender this in schools. That to me was the gap that I saw, and I reflect on from the set of indicators. And maybe it's a call to arms for us to say, well, what do we know about government policies now? And programs that that inform government policies that actually can catalyze systemic change. And can we go out there and try to understand what is working? Because even if we get the ear of ministries, what do we tell them to do? Is it line items in schools for menstrual health? Is it some other policies requiring the distribution of menstrual products? And so what is it? What are the policies? What are the funding lines that we need to actually push on? So I'll close there and thank all the panelists, thank all of you, and thank the sponsors.
Thank you very much. Actually, I forgot one thing. If you want to keep the conversation going, at the GIZ Swiss Water Partner booth, there will be this afternoon, we can come by to mingle, an informal mingle. So many people, you're very much welcome to come and talk more face to face and not in this big room. But thank you all very, very much. Excellent presentations, excellent comments and insights, and let's congratulations on the good work and keep up the good work. Thank you, bye-bye.